I think we'll go ahead and start. Good morning, everybody. I'm Dave Wansenreed, the facilitator for the coalition here. And we are fortunate this morning to have two representatives, one of whom I just met, but Keely McCabe is someone that I was introduced to by Deb Anderson, who's on the board of Mountain Pacific, about 3 weeks ago, right?
Yeah.
And she has an exciting program that she and Jennifer Barnett, who's on the line with us as well, are going to talk about. It's a platform that assists clients and patients connecting with services that are available so that when they're discharged from the hospital or if they're discharged from any kind of medical care, rather than being left to their own devices, there's a system in place that's going to be available, hopefully, in the short term statewide to assist individuals with connecting with services they need, homes, shelter, food, and the rest. So with that, Keely, everybody has your background, and I'm going to let you turn it over to you and ask. And thank you for joining us this morning, along with Jennifer.
Great. Well, thanks, Dave, for that introduction. And thank you all for inviting us to this meeting today. We're super excited to talk about what we're doing here in Montana. Just a little clarification to begin with. Unite Us is our company. That's our organization we work for. We're a national company starting coordinated care networks all over the country. And then Unite Montana is our project here in Montana. So we kind of throw those terms around a little interchangeably, but it is, Unite Us is our company. Unite Montana is our local coordinated care network here in Montana. We are also, just as a side note, we're also starting networks in Wyoming. So we have a Unite Wyoming going on. We have Unite North Dakota, Unite South Dakota. So as I talk through what it is that we're doing, you can just keep that in mind that as we move through the next year, we'll actually be able to connect with and coordinate care with our neighbors in our neighboring states. So that's going to be pretty cool. So I'll tell you about what that means here. So here we are. Let me get my slides here. So what is it? What's the goal? Like why do we want to talk to you all today? Really, the main goal of all of our coordinated care networks is to ensure that everyone in the community is getting connected to and access to the resources that they need to really get well and to stay well. I'm sorry.
You can't see your screen.
Share my screen.
I was waiting for a good pausing place.
I just realized I didn't have the little border around my screen. There we go. So here we go. We have this nice picture of this this lady here, this community member. So she gives a good sort of representation of what we're talking about here when we're talking about, getting people connected to these services, right? So these are all the different kinds of services that a person might need to live healthy. And, that means we know folks are either transitioning their stages of life, they're transitioning possibly out of crisis and into stability, but whatever their circumstances are, people will need a variety of different services to be successful in those transitions. And those services exist in a lot of different systems. And those systems have typically been kind of fragmented and siloed. And so historically, clients, patients, right, community members have had to really figure out how to navigate all those different systems in order to get to the services that they need and get those resources and get connected. So what we really want to do is connect people like this nice lady here to some people in those organizations that provide those services and resources. So it's really making that direct connection, and so that we can improve our coordination and our communication and really get that care wrapped around each community member. And where we're at as an industry is really focused on building an efficient system of care within the community so that we can really move the dial and really improve health overall for folks. And so Unite Montana will help elevate referrals to social services so that we can efficiently coordinate the care in the community and then leverage those meaningful insights to really improve the system. So the main product that Unite Us produces is a referral platform. So it's an electronic referral platform. We call them closed loop electronic referrals. And it is for any provider. So when we say provider, we're talking about all of you folks in the healthcare world, healthcare providers, human service providers, social service providers, really everybody that is working with people, is uncovering needs and helping people get connected to resources. And so when we say closed loop electronic referral, really what we're talking about is there's a sender and a receiver. And it's taking that network directory, that resource directory idea just to the next level and really, identifying in real time what resources are out in a community, who's eligible for them, which programs are offering which resources. And then the next level is really getting them connected, right? Getting that person connected to another person in those organizations. And so there's a sender of the referral and then the receiver. So when somebody's receiving a referral, like if one of you all were working with, we'll call her Mary here, and you identify that Mary has food insecurity, you would be able to send a referral to a food resource. And then somebody's on the other end of that, receiving that referral, acting on it. So there's some action. So they're going to accept the referral. They're going to reject the referral. If they have to reject the referral, there will be a reason why. They have to put in why they had to reject that referral. Maybe they were at capacity and just simply couldn't serve her. Maybe she's not eligible for some reason, but the sender of the referral will have that understanding and really know why that was rejected. And then if the referral is accepted, then that means that person who's accepting the referral is saying, I'm taking on the responsibility to call Mary and get her enrolled into my service. And so then once they accept a referral, it turns into an open case. And then when cases are closed, they're closed with an outcome logged. So what's the outcome? Was that service need resolved and Mary got her food and she's good to go? Or was that service need not resolved, right? So maybe they tried calling Mary 5, 10 times. They could never get a hold of her. Maybe they talked to her and she didn't want the service. So whatever that was, they would note that as well. Maybe that is an unresolved service need. But really the takeaway is that everybody, and especially the sender of the referral, will have a good understanding of what needs of Mary's are getting met and which needs are still out there that she's going to need some help with. So then just zooming out just a little bit, and just want to fill you in a little bit about Unite Us as a company, and then we'll kind of zoom back into exactly how we're doing this work in Montana. So Unite Us actually started back just back in 2013, and our co-founders are veterans. And so they were transitioning, they were transitioning a stage in their life, and they were transitioning out of the military and back into civilian life. And they found themselves in that position to really have to navigate all of the healthcare, the VA healthcare system, and then all of the different social and human services that they needed. And they were in that position, right, of having to sort of figure out all the fragmented silos. So they came together and they created the first coordinated care network out of New York, and it was just for veterans. So it was a veterans coordinated care network, and it was very successful. It was really successful in getting veterans the care they needed quickly and efficiently. So they decided to expand it and say, all right, everybody needs this level of care and coordination. And so cut to where are we at, 7, 8 years later. And here's our map of where we have some coverage and networks around the country. As you can see, we're in most states at this point. We at least have started some networks in most states. We do have plans to start networks in those handful of remaining states soon. And really, like I said earlier, the idea is that eventually the whole country will be on the same coordinated care network. So even though we'll have Unite Montana and Unite Wyoming, we'll be able to really send and receive referrals to and from anywhere in the country. So that's going to be really convenient, I think, to have everybody on one network, because we know, right, people have to travel for healthcare. We know often folks are going to Salt Lake or Denver for their specialty healthcare. And then, so eventually those folks in Denver will be able to make some referrals for people back here in their home community and really make sure that that care is getting wrapped around them. And these logos here, so these are just a few of our partners around the country. Oops, slippy slides. So these logos are sometimes funders, sometimes partners. So we're partnering with sort of a variety of entities kind of spanning the gamut of healthcare, state government, and some large national organizations. So we have, you know, a lot of healthcare entities on here. So our regional funding is actually coming from Sync Health, and that's a health information exchange out of Nebraska. So that Sync Health was really invested in getting statewide networks over several states. And so they're funding the Central States region. And Sync Health is really invested in making sure not only that these social determinants of health are getting met for folks in communities, but that also that we're gathering all of this data to really be informed about who's in our communities and who's using what services and who needs what kind of services. So lots of data that can go into this, and I'll talk more about that in just a minute. Let's see, we, because of our, one last thing here, because of our funding structure, which is hospital systems, health insurance plans, health information exchanges, like I said, are all really on the funding and the payer side. We're actually able to offer this platform to nonprofits and community-based organizations in the community for free. So that's really how we can make this a sustainable network. So our healthcare entities are sort of our paying customers, and our nonprofits we want on the platform, and we know that technology can cost money that nonprofits can't afford, not always. And so being able to offer this platform to nonprofits in the community for free is really a game changer in helping make sure that we have a really robust network of services so that we can onboard such a variety of nonprofit, large nonprofits, really small nonprofits, sort of everybody who is providing some really valuable services to our community members. All right, so then zooming in a little bit, right? We zoomed out, so we're going to zoom a little bit in, and this is this is when we're talking to nonprofits and community-based organizations. This really represents a typical workflow for them. So you can imagine Tom here as a client, and Tom has a need. Maybe he's unemployed. He lost his job during COVID, and he knows he needs to get a job. So he goes into the job service office, right? So people might know where to start and say, okay, well, I need a job. I'm going to walk into job service and get some help, you know, with my resume and applying for jobs. And so let's say Sue here is a job service case manager. And so she's working with Tom, helping with his employment. But then she finds out that he also has, you know, he's also running out of food because his dollars aren't getting stretched that well. And he's also behind on his utility payments because he's been unemployed for some time. So traditionally, Sue would have to either pull up some flyers or maybe do some Google searching or maybe look at a resource directory and pull up some information and say, here you go, Tom, here's some places that might be able to help you with those other needs, you know, outside of what Sue can help him with. So here's some phone numbers, call around and see what you can get connected to. So instead of doing that, Sue could simply log on to Unite Us, put in a little bit of information about Tom, get his consent, and then send off multiple referrals for the variety of different service needs that Tom has. Sort of in one fell swoop. She can, you know, put in the food assistance referral, she can put in the utility assistance referral, and whatever else Tom needs, and just get them sent off. And then Sue here will be able to see which one of these, you know, which of the referrals are getting accepted, which referrals might be getting rejected, and sorry, my slides are slipping around here, which service needs are being met, and which ones are still unmet, where there's still a service need lingering out there. And then when the cases are closed, as I was talking about earlier, Sue can really see what's the outcome there. You know, so did he get that food? Did he get that utility assistance? You know, is his service needs truly resolved or not? And she could also see if somebody, maybe he met with a food bank and they referred him to a clothing closet. She could be able to see that too, and just really have a lot of transparency around Tom's journey. So shifting a little bit and just looking at, you know, that was really from a nonprofit CBO lens, but thinking about folks in healthcare world, you all working with your patients, really looking at what are the services and needs that your patients have outside of your clinical walls, right? So this community-wide infrastructure is really critical to serve individuals in need of services, as you know. So building and growing accountable networks powered by our referral and outcome tracking data service serves as the infrastructure to really ensure that connectivity. And Unite Montana can really be the mesh that holds all of these systems of records together, that really connects everybody. All right, so it's a fun new slide. So maintaining a single person record ensures that we can build a longitudinal record, providing visibility around a person's care journey really throughout their life. You know, this supports effective care coordination, making sure that providers across sectors, regardless of what systems like you all are using, you can make sure that you're serving the individual and know the right information to make informed interventions and really provide dignity and ease for the individual seeking services. So a little bit about data measuring, right? We want to measure the outcomes. We want to know what's going on in a community. The Unite Us data and analytics capabilities can really drive our network efficiency and efficacy. So by leveraging the standard social care data, Unite Us has a team of social care data experts. So we work with some really brilliant minds who are our data team, who have developed and curated some dashboards that really are enabling our partners and our customers to take those findings and put them into action. So there's a network impact dashboard. So you can really see that's what this little graphic here is. It's just a demonstration of a network impact dashboard. So you can see the impact that the network is having, sort of across demographic or service types. There's also a really great health equity dashboard. And these are really, you know, as Dave and I were talking at the beginning of the meeting, these are some of the reasons why Unite Us networks are partnering with health information exchanges around the country, and then, you know, regionally with Sync Health, to really collectively gather the data, measure the impact, identify the disparities, you know, who's getting what services and who's not getting which services, and then really helping to fuel that community conversation around identifying gaps and disparities, and then hopefully starting to have those conversations of really how as a community can we address that? How as a community can we address these gaps and lessen the disparities of services that people are getting? Great. So the pillars, come on, pillars. The pillars of Unite Us, all Unite Us networks. So in order for this coordination to work at the scale that we envision it, we really have to keep these three pillars in mind. And these are really foundational to our success and to our impact. So Unite Us has invested heavily in these three pillars that are focusing on leading the industry when it comes to privacy, interoperability, and impact. So really all of the work at Unite Us is centered around these three pillars. And we'll get into that just this next slide here. So client privacy, you know, we talk a lot about coordination of care, and we all know what that means, right? We know that this has been historically a little tricky due to our privacy and compliance, and due to wanting to really uphold and do our best by clients and protecting their information. And at Unite Us, our top priority is client privacy. This priority is really embedded and integrated into everything that we do, from how we build our technology to training and working with our partners in the community, to the industry conversations that we are continuing to participate in as a company. And for our healthcare partners, we're focused on upholding an even higher standard for privacy and data protections to ensure really impactful care coordination. And in order for us to prioritize client privacy, we're ensuring the following. So first, we never share client data without consent. Second, we protect clients' most sensitive information. And third, we keep client data secure. So I have, you know, always thought about Unite Us that they've put so much thought to really build a really great system, really carefully and really with a true understanding of what the implications could be if not done right. So just a tad bit more on security. So we know, again, in order to really have this care coordination be successful across health and social care providers, that we need to be able to securely share some data, right? So that's why we've built and continue to grow a really sophisticated privacy ecosystem to ensure that clients and individuals only have to tell their story once to access the care that they need. So we do this by, again, the client consent. Clients have to consent one time to having their information shared on the network. Their consent can be withdrawn at any time, and our consent is available in many languages. There are role-based accesses. So we permission access for users based on their role. So protected health information is only seen by users with the correct permissions, and users can only see information on the clients that they serve. We have sensitive data protection. So we've built enhanced protections around sensitive information. So substance use services, mental health services, HIV/AIDS services, maybe interpersonal and domestic violence services, legal services, those kinds of things have extra protections, extra veiling involved with those service episodes to make sure that only the people who need to see that information are really privy to it. I know I was talking about how great it is to have visibility into the client journey, but we all know there's some caveats, right? There's just some things that can't be shared widely and publicly, and then needs to be less transparency around. And then data security. So we're HITRUST certified. We are SOC 2 Type 2 certified and NIST, N-I-S-T. I had to learn some acronyms when I started working here. We're also, of course, HIPAA compliant, and we're aligned with the federal privacy regulations, which includes 42 CFR Part 2 and FERPA. So that really is that's our Unite Montana and our Unite Us company. I do want to, I was gonna ask Jennifer if she could give us a quick demo, but I wanna ask you, Dave, is it all right? So we're actually not supposed to record when we do a platform demo. Is it okay if we shut the recording off for a few minutes so Jennifer can show the group here what the platform looks like?
I'm assuming we can do that, although Alana was going to have to do that. And Alana, is that something you can do? Can you shut it off?
Yep,
Can you
I sure
pause
can.
it?
I'll pause the recording.
Okay, thank
Okay.
you so much.
Thank you, Jennifer, for the presentation. And
You're welcome.
do you have any other thoughts you'd like to share before we open it up for questions?
I would also like to thank Jennifer for that great demo. It's always nice to have a partner presenting. And so I just wanted to, a few things, and I'm not sure if I mentioned earlier, but so Jennifer was showing, that perspective of nonprofit, community-based organization, and it's a really easy web application. You can just go to uniteus.com and log in, so you don't have to download anything onto your computer. But I did want to throw out there that we have a lot of integrations with electronic health records. So when we're looking, partnering with our healthcare entities, we often are being able to integrate into their system. So they have like a single sign-on type experience with the Unite Us platform, just to make it a little bit easier on, we know our healthcare professionals have to deal with a lot going on. So instead of really having to click out of something and back in, like it can, if that comes up in the partnership with Unite Us, that's a possibility. So just wanted to throw that out there, but thanks so much, Jennifer, for showing us that. But yes, that is it. I'm just have up here on the screen. I'll send Dave some follow-up information after we're done here today, and then he can send it out to you all, but just so you have our information here as well. So, but yeah, we would love to hear any questions, thoughts, ideas, really anything.
Well, thank you both for an excellent overview of what you're doing, not only here in Montana, but elsewhere. And we'll open it up for questions. So for those of you that are on the phone or online here, fire away. I've got some questions, but I want to see if the participants have questions first. Anybody out there?
Dave, good morning. It's Lynn from the Alzheimer's Association. Wonderful resource, wonderful presentation. Thank you, ladies. Of course, I'm curious how one would become a resource to be identified in that database.
Sure. So if you are, and I think you are, from a nonprofit organization such as the Alzheimer's organization, you actually can we can send you a partner registration form. And so for all of our nonprofit providers, it's really as easy as submitting a form. And did you put the, oh.
No, I just met Lynn
That's so funny.
last weekend.
Great. So Lynn, we can get you the form. And it is really, so when Jennifer was looking at the browse map function, all that information that is, here's the organization information and then the programs under it, all of that really gets to be dictated by the organization themselves. So there's a form and you can fill out the form according to how you want your program set up in there for people to find you. And we can also help. It's a pretty intuitive form again, but we can also help with that, just figuring out, as Jennifer was selecting the service types, that's often what we talk through folks with. It's much like a keyword search. So you want to make sure that your service types are being represented of what services you offer so that folks can find you when they're searching for you. But it's really, for our nonprofit partners, as easy as filling out a form, which we can get to you.
Thank you.
Yeah.
Wonderful.
So let's assume that one of our listeners who's a home care provider wants to be able to participate in the system and refer their patients or clients to your system. Do they do the same thing? Is there a registration for them to participate as a referral?
Yes, so it's pretty much the same across the board as far as our registration form. I just know that we kind of have to pull apart the layers and figure out what kind of organization it is to really determine if there's a fee structure or if not. So there's some gray area there, as you know, and I feel like some of you are probably in that gray area. So we can talk, and we can also bring in our strategic sales director, Jake, who knows all of this like the back of his hand. And he's the one who actually is working with our healthcare partners and collaborating with them to get them on the network as well. But we can definitely take a look and we'll just have to figure out what kind of organization you are and where you fall on our spectrum.
Okay.
But yes, I would love everyone and anyone who's interested to let me know, and we can start kind of sifting through that too and figure out where you're from, what's your organization like, and where would you fit.
And let me ask you, although it may not make sense, but for-profit organizations, there's a fee structure that if someone decides that they want to participate either as a referral or as a resource, is there some sort of fee basis then that a for-profit would pay to participate either way?
Possibly.
All right.
It
Well,
really
that's,
is like an individual conversation because, like Healy said, we have some wiggle room and some gray area because of the funding of these big healthcare entities. So it's just an additional conversation.
okay.
Yeah, and it depends on things like how many users and what kind of organization, like I said. So we kind of will like tease through those details to figure out kind of where folks fit on that funding spectrum. And so I would love to say, no, we'll give it to everyone for free, but my sales guy will not appreciate that because there
Understood.
are some folks who are sort of clearly in the accounts side. So straight off the bat, the things that are coming to mind are, St. Vincent's, SCL Health, Billings Clinic, like they will fall into the payers zone. Most others of you might be in a gray area. So we'd really have to kind of dig a little bit more to see where you would fall.
Got it.
Yeah, I have a question on as far as entities in Billings that are signed up in this organization. Are SEL and Billings Clinic signed up with you folks?
So we are having conversations. We've had a couple of conversations with SCL folks, sort of our local care coordinator. I'm sure you all know Mia Gravard. But she, of course, has to kick it to her enterprise level, and the enterprise for SEL Health is, I think, out of Colorado. So yeah, our accounts folks are having conversations with SEL Health's enterprise level folks. So far, we just went live last month, and we have a good group of organizations on board. So we have right now just nonprofits. So it's really just that social service provider to provider network right now. So we're just starting with, who was interested in jumping on board right away. And then we'll be doing this work really throughout the summer, but also kind of forever after that. So we'll continue. And that's really, I think, one of the other benefits of Unite Us is having, people like Jennifer and I here in our state to just continue this work forever. Because even after we onboard most organizations, we'll have more. There'll be new ones, or we'll just continue to do this engagement work and keep building out the network. So for right now, we have some really great organizations in our reentry world. So folks who are working on helping people transition, out of incarceration. We have some great veteran providers. So the Veteran Service Office, we have Job Service, we have STEP, we have, just some really cool organizations have been popping up. We have the HER campaign just joined this week. So I don't know if you know about the HER campaign, but they provide emergency and transitional housing for victims of trafficking. So sexual violence and trafficking, which is a super cool thing. And emergency housing is such a huge need. Chinook horses, right? Equine therapy, they came on board. So, it's actually been really fun to kind of discover all the really cool things going on around our community. Does that help?
Other questions? So is there a website? I noticed with the contact information, does Unite Us have a website that would be helpful for someone just wanting general information to get started?
Yeah, absolutely. So we have Unite Us has a website, and I'm going to actually pop into the chat our Unite Montana website. So they look very, very similar. They're some of the links when you're in the Unite Montana website will actually just take you to the Unite Us website. So, but on our Montana Unite Us page, we also list events. So we'll have we always have community information sessions running, and those are really very general sessions just for anybody who wants to come listen and hear about Unite Montana. And then when we have any other, partner spotlight events or training opportunities, we'll put those on the events page as well. But yeah, there's a lot of information and resources on our website. A lot of great, some flyers that show, some very similar things that I was talking about in the slide. So yes, I would encourage you to check it out. There's, we have also, once, you kind of get into the Unite Us part of the website, there's some really great blogs. We have some great blog postings, and you can kind of get an idea of how folks around the country are using our networks and kind of the potential. So some of our networks have been around for some years, and they're really kind of tapping into the full potential of Unite Us products. So it's really cool to see. And of course, they have some really great data. Their networks have been up and running for some years. And so they have some super cool data dashboards to check out too. But yeah, there are some blogs about, some really cool sort of different aspects of the coordinated care systems.
Other questions or comments?
Hi, this is Chris Carlson in Kalispell, and I was just curious if you're connected in with the 211 network for referral that we use currently.
We haven't. We have been having some conversations just here in Billings with, our local United Way, and really just trying to figure out how we can partner with them and where we might be able to partner with 211. So Unite Us has a variety of different kinds of partnerships with 211s around the country. So it's really kind of up to our local 211s to figure out how we might want to partner and collaborate. But, it can go all the way to, sort of that far end of the spectrum of really integrating and absorbing the resource directory, and they absorb our resource directory, sort of the data kind of going back and forth. And then there's lots of different partnerships too, where 211s are simply a user on the platform and they use it to send some referrals. Some 211s are using it as their main referral connection, and some are just, sort of participating in a lower level. So it really runs the gamut. So we haven't had any conversations with Montana 211 yet. So we just started, but they're definitely on our list of really kind of sitting down with and chatting about how we might be able to partner.
Okay, thank you.
Keely, talk to us a little bit about the coverage you have now in Montana, and in the intermediate term, what your goal is to have access statewide. Is that something that's going to happen by regions, or is it, how's it going to happen?
Yeah, absolutely. So we have a wave schedule, and actually I might be able to pull it up really quick to show you our wave. So we started with the southeast corner of Montana. Here, let me put this over here. And let me share one thing really quickly with y'all. And I can show you our wave schedule so you can get an idea of kind of what our plans are here. So we started with, are we looking at my state? Yep. Okay, cool. Let's make sure I had a lot of tabs open. So our blue region here is what went live last month. And so we've really been focused on and working with folks in our southeast corner here, a lot of conversations, a lot of meetings. And that's why we have sort of sliced out the state, it's a big state. And we want to really make sure we're having a lot of good conversations and really, as I said earlier, building that accountable network. We really want partners who are invested in the network and in, having that accountability and closed loop referral. And so our plans, as we're still working on, and again, we'll be onboarding folks forever, but we're focusing our efforts here. And then very shortly, actually, we'll be popping over to Jennifer's neck of the state and working on these counties over here. And then we'll move to the middle and get the Helena Great Falls area. And then we'll get to, our other sort of, so that's, as you can see, the date here has us projected out through 2022. So by the fall of 2022, we will be live across the whole state. That is our plan. And our idea was really, to get some of these more metro area service hubs on board, because we know there's folks up here. They're few and far between, but they're up there and they need services. And we also know, unfortunately, they have to travel right to Billings, Great Falls, Helena, Missoula, Bozeman for services. So we're hoping then, our idea is that by the time we get to especially the High Line up here, that we'll have lots of services on board so people can really get connected to and access those services, even if they have to drive. But we're finding also there's a lot of telehealth services and some virtual services that folks can access in some of these other areas, but they won't necessarily have to drive to. So I think that's actually a really cool added bonus, right? The silver lining of COVID was that a lot of organizations figured out how to virtually offer services. So that's going to be really helpful for folks in these very rural areas. Back up here somebody else asked, but here's a good representation of what we got going on so far.
Very useful information. Anybody else have any questions? Just cover for us one more time all the safeguards there are for client and patient information security. Can you just talk a little bit about that one more time so everybody's comfort level is, all the safeguards that you have in place in your system? Sure.
So, one, I think one of the biggest game changers is really the technical infrastructure itself. I was very impressed with how much thought has gone into it. We have a compliance and legal department. And so when they built the platform, they really made sure that, it's HIPAA compliant, it's FERPA compliant, FIPS. We did get our high trust certification recently, which I've been told is like the highest level of like security and privacy certification that you can get. Our legal and compliance department actually also does annual and biannual testing to make sure that our platform stays compliant. You know, not only was it built with a lot of privacy and security in mind, but that as things change, that our platform is staying on top of those changes and really being responsive to any of the changes in any of the laws or legislation. And then, so that's our technical infrastructure. And then I think the other really important takeaway is our client consent, that the client has to consent one time to having their information shared on the network. It is really specific to having their information shared on the Unite Montana network. And that doesn't replace anybody's ROIs or HIPAA releases. So it's just simply for sharing their information on the network to get connected to services. We have, we set organizations and users up depending on what services they're providing and what level of information they need. So organizations can choose, some organizations, I should say, can choose to have their programs be sensitive. Some others have to be sensitive. So as I was saying earlier, our sensitive service type feature, which is, you know, domestic interpersonal violence, substance use services, mental health services, legal services, there's a certain amount of services that have to be configured as sensitive. So when they're configured as a sensitive service type, they have extra layers of protections in place, which really means only the sender and the receiver of those referrals will be able to see those referral episodes. So as Jennifer was showing us earlier in the platform, you know, for that gentleman she was looking at, you could see kind of the variety of different referrals that he had going on. But if he had a referral that somebody had made for him to a mental health service, we wouldn't be able to see that if we weren't involved. If we're not the mental health provider or the sender of that referral, we won't be able to see it. So that's the kind of extra veiling and protections for sensitive service types. And then just our data security. Our data is very secure and stored in the most compliant and secure ways possible. Oh, and then user level roles too. That's the other sort of privacy protection, is that we have different roles for different users. So there's a case management level role for a user to just get in and, you know, send referrals and receive referrals. And then we have all the way up to like an organization administrator role. And those folks are able to, you know, deactivate users or change their program information, as Jennifer was showing us, that accepting referrals button, you know, people with organization administrator access can toggle those things on and off and update their organization information. And they can also download and export their own data. So any of the clients that you are directly working with are your clients, and you own that data, and you can download it and export that client data, which is, you know, there's service needs, the referrals, and the outcome information. And then everybody on the network can see this network-wide aggregate data. So there's some dashboards that every user will be able to just see, or the users with the organization administrator access can see, you know, what's going on in their community. So that's just that aggregate de-identified data, but, you know, the numbers of referrals and the numbers of referrals to the different service types. So all of that kind of thing. I think that's it. Did I cover it, Jennifer?
Yeah, that was nice and thorough. Great job. I was just gonna see if I could share my screen again. I pulled up the same, so this is obviously our demo network, but I pulled up the same person's profile via 3 different organizations, just to give you a more tangible view. And it's going to be tiny, but I'll just draw your eyes to a couple of things. Am I sharing the wrong screen?
Nope, you got it.
Okay. So over here, you can see this person, Precious, has had referrals sent on her behalf from this organization to these 3 different organizations. So Mental Health America will appear here because it was involved directly in the service episode. So Daniel, the user here, sent a referral for Precious to Mental Health America. However, you'll see in the referral to that organization, once the organization on the other end accepts it, which really just means they have the capacity to serve the client, not that they're actually delivering services. Okay, that's a little nuance that helps protect, again, those people, and we train that way. But it becomes locked to me, and I don't get to see any other details associated with that referral once it becomes a case. Now, that same person's profile with this sensitive organization, I get to see everything. So if I go into cases, obviously, because I'm delivering those services, I can open that, make notes, upload documents, really interact with that and provide a resolution. And then as a bystander org, so an org that's still working with Precious, but is not directly involved in that service type, take a look at, I know this is small because I'm using my giant monitor and I have 3 things open, but let's take a look at her profile. The mental health organization is not apparent anywhere on her public facing profile. So it's not part of her care team. I can't even see that case exists, right? That's that extra veiling we were talking about to make sure that only those people who need to see get to see. We take that very seriously, and actually there's a great blog about how we protect the most vulnerable populations on our website. If you're interested in that, we can send that your way.
Sure. Great. Thanks, Jennifer. That's great.
So is there any stone left uncovered here? You did a marvelous job of covering a lot of territory here. Does anybody else out there have any questions? Just make one closing thing here. Back in February, we had the Health Information Exchange make a presentation. What are the possibilities for these 2 systems to work collaboratively and still protect patient privacy? Can you talk a little bit about that in closing here?
Yeah, for sure. And I met with Ben Terrell, and he is very interested in partnering. He's got some other things he's tackling this summer, but we're going to connect back at the end of the summer and really kind of talk about how we might work together. What I can say, I'm not the expert on systems integration or interoperability, but I know that we do this, and we do it with really large health information exchanges. And so I can't speak to exactly how that happens as far as like that technical infrastructure, but I know that we have data sharing agreements. So that's where some data sharing agreements kind of come into play with our partners and some key folks who are really wanting the data and wanting to look at the data. And I believe also that is what drove Unite Us to create a data team. Once we started partnering with health information exchanges, and we started with like a 1-person data team, and I think they're up to a whole team at this point. I think 5 or 10 of them. And so those folks who are really getting their heads down into this data analytics are the folks who are really working closely with the health information exchanges. But I do know like Sync Health is a really tight ship as far as privacy and compliance. So as I'm not the expert and can't speak to exactly the technology that goes on with the data sharing, I do know that it is working according to some really high privacy standards. So that's what I can say, but it can definitely get, if anybody's interested, and especially as we work with Big Sky Care Connect, I can get you some more details from my very brilliant colleagues who know how all of those things work together.
Any other thoughts, questions, comments? Keely and Jennifer, thank you for a job very well done this morning. And I just want to remind everybody out there, I'll send a note out that for those that couldn't participate today, this meeting was recorded except for that portion that we shut off for the protection of proprietary interests. And we'll be sending that out. So if you feel like other people should have been able to access the meeting and didn't have time, they'll have a backup plan. And I'll distribute all of your contact information. Keely, if you'll send me a copy of your PowerPoint.
Yes, absolutely. And I will get you some information and some links to some quick facts and some quick really nice flyers that kind of sum up a lot of what we've been talking about.
That's wonderful.
Great.
Thank you both for a job very well done. And I want to thank all of you for taking the time from your schedules to join us this morning, and wish all of you a wonderful day and a wonderful upcoming weekend. Thanks again, to everybody, for joining us.
Thank you so much.
Thank you so much.
Take good care.
Bye-bye.
Bye.